Hello, everybody. How you guys doing today? Welcome to Connecting the Dots. This is episode number 2. We're doing this for Stroke Survivor or Stroke Awareness Month, the month of May of 2021. Today's episode, we will be dealing with occupational therapy. I have with us two great people that's going to have our conversation going pretty well today. The first person I have is Eugenia Herbst, and I have Tiffany Anderson. Now, Gina is a occupational therapist here in Atlanta. She works for a company for the last, 30 years? Well, I'll let you introduce yourself and tell us everything about yourself. And also we have Tiffany. She is a stroke survivor. She's here to ask some questions of Gina and actually find out what she can do to get herself better with her ailments after her stroke. So ladies, let's introduce ourselves. Gina, why don't you go first? Tell us who you are and what brings you to this table.
Sure. Hi, everyone. I'm Gina, and I am an occupational therapist. And as Greg said, I've been working for a long time, the last 20 years or so here in Atlanta at a company called the Shepherd Center. So we work with individuals who have had traumatic brain injuries and strokes. And my passion has been helping those with neurological injuries. And so part of my goal and reason for being here tonight is that I enjoy knowledge and I enjoy learning, and I also enjoy educating others. So I am here tonight to learn from you all and to participate in the dialogue so that I can also help pass this along to other OTs and future clinicians and clients and caregivers as well. I think we can always learn from one another. So thanks for having me.
Well, Gina, thank you so much for participating in this. I've been searching wide and far for people to help us out, and I'm very grateful that you are actually taking some time out of your day to actually join us and help us out with this information. I have a lot of people out here that really will benefit from what you're telling us from this actual Zoom call and also on YouTube. So I really appreciate you coming in. Thank you.
Sure.
Tiffany, hello, how you doing? Tell us a little bit about yourself and what brings you here today.
Hi, I'm Tiffany Anderson, and I am here because we're going to talk about the OT situation. But 2.5 years ago, I had a stroke in the middle of a benign brain tumor. I was getting that removed, and in the middle of it, I had a stroke. Don't know where the stroke came from, don't know how I got it, but now I'm a stroke survivor. So I'm here because I want to know more what I can do with OT to help me get through my days, and that's it.
So let me ask you something, Tiffany. Since you had your stroke, what ailments do you actually have that we can talk with Gina about and see if she can help you out with this stuff?
Actually, my whole right side is kind of off a little bit. I say kind of off because I still believe that I can move it, but I can't really open my hand. My hand does not open by itself, and I can't see out of my right peripheral eye. So those are the things that the occupational therapist would help me with.
Copy. So Gina, I guess this is a probably normal thing that you're actually seeing, that a lot of people, especially in these time and days that, we have this pandemic and people don't want to go to the hospital or people don't want to go to therapy. Do you see this a lot, and what problems this actually causes you actually as a therapist?
Yes, I think the pandemic has affected each of us very differently, but one of the things that I think we have learned is people's hesitancy to want to seek medical treatment if they're not feeling what their normal is, or if things are feeling different, because we are not sure what we're going to come up against as we go to these hospitals. And there is I think what we're hearing out there of kind of a fear of catching COVID by seeking some medical attention and so forth. And I think that is one thing that we can all help pass along to others is, your body, what feels right and what feels different. And it is so important to pay attention to those signs of what feels different and to seek medical care. Don't be afraid to go seek care from the professionals. So,
Tiffany, do you have trepidation actually finding or going to the actual therapist because of COVID?
Actually, I I do a little bit just because they do not take outpatients right now, because they're not taking outpatients. But before I was going to see them like every day. But they tried to do the telehealth on me, the computer, going on the computer, trying to do that on me for about 2 months, but they said they would rather have me in the office, so they wasn't able to do that. So they gave me some work to do at home on my own. And of course, you got to remember to do those things. And so I tried to remember to do all of those things that they told me, but I haven't been able to go back because they're not taking outpatient patients yet.
Yeah, I completely understand that. But Gina, let's really dive into this, because I know most of the people on this call probably already know what OT is, but can you really break that down for us so we can understand exactly what we're supposed to be getting out of OT, what it's all about?
Sure. And OT again stands for occupational therapy. And a lot of times when people hear that, they think occupation, well, is that somebody's job or is that their work? So are these people going to help me go back to work right now? So actually what OT and occupational therapy is, or it means, is it's really like the therapy and therapeutic use of using everyday life occupation. So we use the word occupation sort of to mean activity or to mean the word doing. So OT looks at what it is that's important to you, or Tiffany, what are those things that would be important to you that you would either want to do or need to do in your day-to-day living? And that's where it can be different for each of us on this call and each of this out there, that we find different meaning in what we participate in every day and what we do. A great example of that is I get up every day and I do to help take care of myself. I have a routine for getting up and getting dressed and doing my grooming, getting my coffee in the morning and so forth. What I don't like to do is I don't like necessarily doing laundry or doing meals or things like that. And those are things that I might be able to either delegate or maybe have somebody else help me with. But for others, maybe a chef, those are things that are very important to them and to that they.
You know what, Gina? I'm glad you broke it down like that, because for me, when I was in the hospital, only thing I thought about is OT and PT. OT, occupational therapy, is working with my hands, and PT, physical therapy, is working with my legs. And what you just broke it down is like more of, your everyday feelings, everyday things that you have to do, that you need to do to survive. And that's your occupation. Your occupation is survival. So I kind of get that. And thank you for actually explaining that for us. Now, did you have a better understanding of that, Tiffany, or was that the same type of understanding you had?
Yeah, that it was kind of the same, but it was more, it let me know a lot more. We have to physically get in there and do, we have to work with our hands. We have to find out something that we can do with our hands that we don't think about.
So Gina, who benefits from occupational therapy? Like, what's the point of actually getting occupational therapy? Who will benefit from that?
Well, that's a great question, Greg. I, as an OT, feel like that everybody can benefit from it. People who maybe have experienced a disability, as well as those maybe who haven't. OT can work not only on the physical problems or impairments that a person might have, but also, as Tiffany mentioned, maybe having had some changes with vision or how the brain makes sense of what you might be seeing, as well as what our emotions are and what our feelings are. So OTs work not only with these physical changes, but also how we're feeling emotionally and what we need to do from a leisure perspective and what we want to do. So I think each person and every person, honestly, could benefit from occupational therapy. And we work not only with adolescents or adults or older adults, but also with children maybe with those who are newborns who have been born with some sort of disability. So our profession definitely stretches across a wide range.
So you're talking about like
also,
motor skills and things like that?
motor skills are definitely a part of it, but I think OT can also help with prevention. And I think after a stroke, one of the important things that OT can do is help individuals to learn how to prevent future strokes and to pay attention to health and wellness and establish new routines to be able to keep us, again, healthy and from preventing other complications that might happen. So I think everybody.
So Tiffany, when she says that to you, you know, everybody, so I know that you said your right side of your body is, you know, I guess not working and your hand is not working right properly. Does your caregiver helps you out with this occupational stuff you have? And does she have to go through that occupational therapy with you to actually make you easier for your life?
Okay, so I try to do everything on my own by myself first, but I do have someone that's here that'll help me. I don't like cooking, I hate cooking, but I will at least try it. I will at least try it with my right hand, doing the little stuff. And like this weekend, I'm gonna be alone, so I'm gonna have to do everything on my own. So I'm gonna have to put a lot of, a lot of attention on. Okay, how am I gonna make me something to eat? How am I gonna, bathe? How am I gonna do all of these things with my right hand? But I believe I can really do it because in my head, I think everything is normal, as that's in my head. But I'm gonna try my best to, use my right hand. I always try to use my right hand before I use my left hand with the things that I do.
So Tiffany brought up an interesting point, Gina. She's talking about, she's trying to do everything with her right hand and also that she feels like she's normal. I guess a lot of people will come to you and say that, because I know when I was in the hospital, I felt like I was normal. Everybody was telling me, Greg, you can't do this, you can't do that. But I didn't think that way. So how do you actually deal with that when you have, patients that's coming to you and I'm like, yeah, you know what? I don't really need my left hand. I write with my right hand, I throw with my right hand, my left hand is not really needed. How do you actually support them and actually get them to understand they need that as well?
Well, I think that's a really good point. And I think two things about that. I love that now, Tiffany, you're out there and you're thinking, I can do this no matter what. I love that you may be learning a different way to do it, but the fact that you can still do it, it might look different, it might feel different, it might take a little bit longer time. I think that's great though. And the fact that you're trying to use that right arm. Were you right-handed before your stroke?
Yes.
Yes.
I was right-handed.
So that's a big factor. Again, you're just all the years of automatically doing with your right hand, you feel like you want to use that right hand. And that's one of the best things that you can do is keep doing it. Now, Greg, the other thing I think that we touched on was the fact that another thing might be you feel like you can do it and maybe don't have what therapists might call awareness or insight that things might be different or might be harder. So there's almost two different things going on there. And for a therapist, it is a bit of a challenge sometimes when people don't have that insight or not aware that things are different and seem like I'm just fine. I don't need that, or I don't need you. Sometimes that's the harder thing for therapies at the time. And maybe, we have to decide, is that the right time for therapy? Or is it, hey, let's take a break for a little bit, go home, try these things, and then you develop some kind of awareness where you realize, wow, things really are different. I could use what they were telling me back then.
No, Gina, I have videos of myself trying to walk because I knew I could walk, but I couldn't walk. I have videos of me trying to eat food that I couldn't swallow, but I knew that I wanted steak. So you're saying that, people just have to take a break, and I wanted to take breaks all the time. How do you know that you're losing that patient, or you're going to bring that person back in? What is that time span? Like, how can you tell? I think a lot of times our psyche is really messing us up, and it throws off all of our therapy. So how do you combat that?
That's a really tough one. I think, it's on an individual basis, kind of with each client and that we see. I think sometimes it depends on how long a person has been in therapy or been hospitalized or away from home or away from their families and away from loved ones. So it is hard. I feel like there's no specific time frame or strategy that I can say, as a therapist, we do this and we know it's this time for every single client, because it's really not. It's up to that individual. But what you said too, the use of the videos, I think sometimes are good for building that insight or building that awareness. So I think it's great that there were the videotapes that maybe in the moment you could look at that and say, wow, that really is me. And wow, it looks like I'm having a hard time. Sometimes by seeing those things over and over, a person can gain a little bit more understanding of what's happening. But other times it depends on the parts of the brain that have been affected by the stroke as to whether or not we can, I guess, get that or understand it.
Mm-hmm.
I have a question for you, Tiffany. When this happened to you, in the hospital, and I guess the first part, like I always, get the same results from all the different stroke survivors, that you're in denial that you had a stroke, and then your body is not working the way that it used to work 10 minutes before. What are some of the things that you was doing that you thought you can do that you couldn't do? Just to throw that out there.
I tried to get up out of the bed and walk, and I couldn't even walk. I tried to eat. I tried to eat so much stuff, and it was so hard to eat. It was so hard. But I tried a lot of things. I tried going to the restroom by myself. Couldn't do that. I mean, it was especially the first week or two, I couldn't do anything by myself. But in my head, thinking I can do it all. I got it. I'm okay. I can talk, even though I couldn't really talk. I can talk. Y'all hear what I'm saying, but y'all got to understand what I'm saying, even though I may be talking something else, but y'all got to understand what I'm saying. So
yeah, exactly right. And how do you deal with that? Like, I know you answer that, Gina, but like, how do you actually physically get up and say, you know what, I gotta go to see this patient. This patient is a little bit bonkers. How do you actually calm yourself down so you don't make this person paranoid? What do you do? What are the things that you actually do for them?
I think part of that is just realizing that this is the impact of having the brain injury. And so knowing that this is where that is coming from is part of it. And then knowing that, again, oftentimes it's with repetition and with the frequency, or how often that we're able to see our patients and our clients, and then that we also have our other teammates, and we're able to provide structure, routine, repetition, consistency. And with these types of things, we can impact change. We can build some awareness. But Tiffany, one of the things that you said really kind of hits home, in that what we see in the hospital very often is people who do try to get up and get going. And that's where we have sometimes a lot of falls or risk for falls and early injuries and things like that. So that's a really critical stage early on. and where we like to have family members
Mhm.
involved in therapy so that we can help a family member learn how to keep you safe, and also help to maybe remind you when you feel like you could get up or you could move and eat. So we like to educate and give the caregivers information that they can share with you in those moments in time. And that helps build awareness.
Yeah.
Okay, I get that. But I'm gonna put a pin in that because I want to get back to that. But I do have another question to ask you before we get to that. And I guess we're going down that little path right now. Gina, when we do get home or if we're in the hospital, what are some of the things? I guess you just said it right there. But what are some of the things that is detrimental to our progress in OT? What should we not do?
Oh yeah.
Yeah, that's a really good one. I think we've mentioned on safety being one of the key things, and prevention of any further complications. So being safe if you're in a wheelchair, or if you're using a walker, or you have to use a cane or things like that, really being able to stop and think before I try to get up and go or do things. So that's one of the keys, is preventing any falls or additional injuries and those types of things. But I think the other thing is, as you get home, just trying to establish a routine. I think, Tiffany, you touched on that, and try to find a way to do your homework, because most therapists are going to give you some homework, and that's going to be one thing that will help you keep moving forward.
Okay.
I'm with you on that, and I'm hearing everything you're saying with that. But the problem, and Tiffany, please chime in if I'm going off the railing on this. But
Okay.
the thing with me is that at that time, I thought I could do everything. I left the hospital with a walker. The next day, I tried to walk without the walker.
Oh.
I was determined. I was ready to go. I didn't fall, but my brother and my mother was walking behind me just in case I did fall, just to be a brace for me. But I was so determined to actually get up and move. Also, when I was in the hospital, I had a feeding tube down my nose. I used to pull it out. I pulled it out twice. They had to restrain me. And I didn't know why they restrained me. Like, why are you doing this to me? I can eat. So like, I'm hearing you, what you're saying about we have to be smart. We have to use our brain, but my brain was delusional. I thought the Colombians was coming in and killing everybody in the hospital. That's how demented I was at that particular time. Tiffany, did you have any horror stories like that as well?
Why?
Come on, be truthful. Be truthful.
I probably had some little days where I thought I could do everything by myself, but I did, because I had my mom there all the time with me. She was always watching me, so I had to make sure that I was doing everything right. But when she would walk away, I would try to do things on my own. And then sometimes I had a couple of falls and everything. When I do those things by myself, and then I finally had to come into my head and like, okay, you're gonna have to stop. You're gonna have to come up with a plan and do those plans and stick with those, because you can't keep falling. You can't keep falling and hurting yourself.
Now, the thing that I had a pin that I want to bring back into the light right now, Gina, is you was talking about your caregiver, teaching the caregivers how to teach, to help us out, to actually get us better and things like that. But what if we don't have a caregiver? What if we actually in the hospital and it's just us? I have people on the call right now that actually are by themselves, and they had to learn everything on their own, and they was going through these things, trying to get back to normal, trying to get back to their intelligence they had before. And how do you actually deal with that? How do you actually communicate with those type of people?
Yeah, I think that's definitely a challenge. And first thing is I can't imagine what it might feel like to have those tubes and then to be that confused and so forth, and know that part of it is the brain injury, and then the other part might be from the medications that you're taking and other side effects and things like that. So again, for those that don't have the caregivers with them, I feel like that's where the nursing and the therapy teams are so important while you're in the hospital, at least, to help keep you safe, which is why they do put the restraints on or put you in a special type of bed and things like that, because they do need to ensure that you don't have additional injuries that can come from falls, which just makes things more challenging. So what do you do when you don't have those caregivers with you or have that that network or that support? I think it definitely has to be more challenging. To me, it seems like, are you then able to create, like you all have done, a network of somebody that you can rely on as a kind of like a support group, at least, and share some ideas of how you have worked through some of these challenges. One of the things that we're doing in our therapy program now to help some of these individuals who maybe left the hospital with restraints on for their own protection, we're looking at ways to reduce those restraints without physically having to do it, but using some of the newer technologies that are out there, some of the smart home technologies or the webcams and some of the devices that might be monitoring systems or reminder systems and things like that. So if we don't have a person that can be with us in person, we might be able to establish some virtual supports potentially.
Okay. Yeah. I guess that's not really applicable to you, Tiffany, because you do have a caregiver at home. But this might be applicable because this next thing I might bring in. And I'm gonna pose it to Tiffany first, but I want you to chime in afterwards, Gina. You know, when you had this stroke, I don't know what kind of relationship you had with your caregiver, but after you had your stroke, now your caregiver had to make all the decisions for you. You're a grown woman, and now automatically you're transforming into a child. How do you actually deal with that? You know, was that a problem for you? It was for me.
Oh yeah, it was a problem because in my head I still can do everything by myself. So I mean, and my mom was trying to help me with things, but I felt like I had everything down packed, but it was difficult for a while. For the first few months, it was a difficult thing. We had to see therapists and everything because it was very difficult, and it was difficult.
Yeah, Gina, how do you deal with that? You say, we have a caregiver here, but let's just say I'm on the rocks with my wife and we're about to go through a divorce, and all of a sudden I got a stroke, and now my wife is making all the decisions for me. How do you actually deal with that as a therapist? And you're talking to the caregiver, you're talking to me, and I'm like, no, I don't care what she says, or I don't care what he says. Listen to me, and then you go back and forth. How do you deal with that? How do you keep that person sane without them going completely bonkers?
And that's a good question too. And I think that happens often because there are different relationships that we all have with different people out there in the world. And one minute we're having that relationship, and the next we're, in a hospital and someone else is having to make those decisions. And we see those roles change just kind of on an instant. One of the things that I was thinking about as Tiffany was talking is Tiffany may, or the stroke survivor may not remember all the details of what happened emergently and immediately after the incident, but that caregiver or that family member does. And they remember sometimes, medical professionals telling them that they don't know, if their family and loved one is going to survive this incident or not, or if they do, who they're going to be like. So the family member lives all the bad times and remembers every piece and every detail of those trauma and those bad times. Whereas, sometimes then the medication wears off, or you become a little bit more oriented as the patient and the therapist, as the patient or the survivor. And so you've got two people who've gone through the same event but have very different perceptions of it. And
Okay.
so it definitely changes the relationship of those. And often, what I mention to my patients and my clients is, just cut your family member a break, cut your mom a break. You don't remember what she went through, but
Yeah.
yeah. So
No,
that's
that's
part
logical.
of it.
That's logical. I get that. A lot of us don't see that. We just say, okay, woe was me, my life is over, or we have to start our life over, and we don't think about the caregiver. And I really appreciate you actually bringing that up, because, I know I gave my ex-wife hell. I had another caregiver. I gave her hell. I gave my mother hell. Only difference is my mother understood stroke survival. So she was dealing with people in a nursing home. She was dealing with occupational therapy, physical therapy. So she understood that. Population and the masses as whole don't understand that. So they don't have the patience. I'm gonna give you a prime example. I'm talking to this one lady. She had a stroke. She had a lot of things going on with her, but the way that she talks, she can't process properly. So all of her information is just running on and on and on and on. And if you don't know that something is going on in her mind, that would be annoying to you. So the normal person sees that and says, you know what? You're just being annoying. I can't stand you. This is the reason why, Gina, in the hospital, we love you guys. You guys are like our angels, because, we can talk to you. You guys understand us. But as soon as we go home, whoo, we want to go back to the hospital, but we don't want to be in the hospital. You get what I'm saying?
I do. Yeah. And that's where I think, again, what we can do is help to educate others on stroke, and not only just prevention, but also what happens afterwards. And then also just kind of disability awareness within the community.
Yes.
And how we're all just people, and we can all just, learn to kind of accept one another as we are. Yeah.
Now, Tiffany, can you go ahead, please chime in? Go ahead.
Okay, I was just about to say, everybody I talk to, everybody I communicate with, I tell them, look, one thing, y'all better understand what I'm saying. So if I go say it wrong, y'all need to be thinking of what I could be saying so y'all can get it. So they pretty much everyone I talk to, pretty much they're like, okay, say it one more time. I'll be like, no, you're gonna get it the first time I say it. So everybody so far has come along, and then some people be like, Tiffany, I just don't understand what you're saying. Can you try to say it right? And I'm like, okay, just give me a minute, or just forget about it.
And that's the frustrating part. And like I said, we love you guys in the hospital, because you guys give us all this information, give us all this love, you give us all this patience. But like I said, when we go home, that dissipates. They think that we're lying. They think that we're faking it. And we're thinking that, it's like a broken leg. Once you heal from that broken leg, after a couple of months, you should be fine. But they don't really understand that we have brain trauma. So we have to restart our brain back from an infant, pretty much. And, some things that we actually are very comfortable doing, but a lot of things we're not. And that I think that's the problem that we have in our society of people. They don't understand that this is maybe a lifelong thing that's happening. Let me ask you something. Let's stop for a second, Gina. As an occupational therapist, is there like a chart that you have to actually say, okay, if this person is at this stage, this is what they need. When they get to this stage, okay, they're ready to do this, that, and another. Is there something like that?
That's another really good question. I feel like as an OT, Again, everybody is very different in what they want to do and
Yeah.
kind of what's important to them. But we do, as OTs, kind of have a little bit of almost like a pyramid or a hierarchy of what we see of things that are important to some individuals, which start with maybe being able to first take care of ourselves before we could be able to take care of other people. And so we kind of call it like our activity of daily living pyramid. And moving from one level to another is sometimes dependent on how well a person is doing both physically, emotionally, cognitively.
Is this what you're talking about?
Yes.
Okay.
And you guys, it's a triangle or kind of a pyramid shape there, but from an occupational therapy perspective, this is where we kind of look at it, and the things that are at the bottom that have to do with myself and taking care of me and my basic needs are what we usually try to start with, because we usually need to take care of ourselves again before we could take care of other things. That second level there that has the bed, the sandwich around the house, those are again like those chores and those household activities that, yeah, most of us need to do on a daily basis, but if we could give it to somebody else to do, that'd be okay too. That's what OT calls an instrumental, or some people an independent activity of daily living. And then it goes on up to the top, then skills that are harder, that take more cognitive skills and problem solving skills and impact others out in the community. Taking medicine, for example, is one of those things that after a stroke is one of those, Greg, kind of lifelong things that it's like, gosh, I have to take this medicine from now on, to prevent future things from happening. And I think it's important that a person be able to learn to do that on their own, or at least direct and guide somebody else to do that. And then there's the can't get away from having to pay for my bills, or look out for my finances. And each level that we go to the top gets a little bit more difficult or more challenging, and it takes more cognitive, emotional, physical skills. And we keep working to some of those at the top where we can live more alone or with someone checking in less often. And then it's often we can get back to work or in the community in some form of vocation. And then the thing that's at the tippy top of that pyramid and that takes so much as far as cognitive, physical, emotional, visual skills is that driving. And all of these things, hierarchy, or as you go from the bottom to the top, build on kind of a danger and a risk as well. So from an OT perspective, we kind of move up the ladder a little bit this way, like this little pyramid.
Tiffany, any thoughts?
That pyramid was pretty good. I do just about everything but drive. I wish I knew how to drive. I wish I could drive. I know how to drive, but I wish I could drive.
But Gina, since my stroke happened on the left side of my body, driving was the easiest thing for me to do.
Oh, wow.
The easiest thing for me to do, because I'm right-handed, and driving was completely easy. But focusing, that's a different story altogether. Like you said, a lot of stroke survivors are different, and you have to deal with them different. So, how would you actually, like for Tiffany, that's a problem for her driving, but driving wasn't a problem for me. I don't know, Tiffany, did you go back to work?
Yes, I'm back working now, but not doing what I did. I was a hairstylist, so I can't really.
Well, we could tell by your hair, lady. We can tell by your hair.
Thank you. But I can't really do hair because of my right hand. But my mom's a hairstylist, and everybody around, all of my friends are hairstylists, so I can go into them, and because I specialize in colors, I go to them and tell them the things to do. I help out, I clean up, I answer the phones, I do little things around the salon to keep me busy and to keep me working.
You know what? I think that's a very important point that she just brought up, Gina. She knows from backwards and forward hair and coloring. So that wasn't hard for her. For me, I could drive. Driving was easy. For my father's a driver, my brother's a driver. I could drive. So that wasn't a big issue for me. But bringing up a new skill, I don't know if I'll be able to do that.
Yeah.
Now,
me.
so when it comes back to work, I know, like I was driving RVs across the United States, but in order for me to do that, I have to take a DOT physical, and I know I will not pass that at all. So I'll have to come up with a new skill. Before that, I was also an instructional designer. I can't focus to be imaginary things and just bring them together and to bring out paperwork or imagery. I can't do that anymore. So the easy things for me, like driving, it's difficult for her, but it was easy for me. Coloring hair, I can't do that. So when you come up with these type of scenarios, how do you deal with that? How do you get people back on their feet to say, okay, you're ready to go?
Well, I think that, in this situation, you're exactly right in that Tiffany knows hair inside out, and that's a passion, an interest, a skill of hers. Then we take a look at, well, what all is involved and how could we tap into those skills and those strengths in different kinds of ways. Same thing again with, you've got lots of abilities there. So we would talk about what is of interest for you and other interest inventories, and look at other maybe components or categories of that. And in OT, we use what we call an activity analysis, which we look at that activity, we break it down, and we identify what your strengths are, or then where we might have to look at that activity a little bit differently, or learn to compensate, or try things a little bit different way. But I think we tap into strengths, and we tap into interests, and we tap into abilities, because anything's possible. So we just have to figure out how to make that possible happen.
Okay.
I get that. I get that.
I get it.
I think Tiffany has some questions she wanted to ask you individually. So I'm gonna allow her to actually ask you these questions, and hopefully, I could learn something from this as well, and we could get a good understanding of what we're supposed to do as a stroke survivor. Tiffany, you have some questions for Gina?
Okay. Let me see. I'm trying to look them up because I can't really remember, so I have to look them up. Okay. How important is it to a person to have OT after being released in the hospital? Like, how important is it for them to go to OT? Like, you have to have OT.
Yeah, as an OT, I think it's important for everybody. I think everybody could benefit from it. But some people, when they leave the hospital, OTs actually come to them and to their home and into the house, and others are able to go into an outpatient clinic. I think, again, it's based on how that person's doing. And if somebody was going home and having to use maybe the walker or the wheelchair or do things a little bit differently, OT could look at how to make sure that you could safely move about within your home. For instance, being able to get into bedroom and bathroom and shower and do those things. So I think it's important there to have OT to help keep you safe. And others, again, helping to adjust to this kind of new and different life, I think is important. So again, as we kind of had mentioned, we can help you come up with different ways to approach what you used to do on an everyday basis. So we can help you do things differently. If it's hard for an individual to get out and go grocery shopping or plan meals or get out in the community or pick up medicines, OT can help you do those things differently by helping to learn maybe online bill paying or online grocery shopping, and setting up alternative transportation and ways to help you be able to continue to get out and engage. So if you don't want to go though to OT when you get out of the hospital, or you don't want to have them come in your home, then I think sometimes it's better to maybe take a break then. If it's something that it's like, I really don't want to do this and I don't want to go. So maybe you do wait for a time and then try again, because motivation is definitely key to being successful in therapy.
Okay. So what are some online resources that we could get to lead people to do the OTs during the pandemic, like some things in therapy that they can do online to help them with the OT?
That's a great question. And I feel like one of the things that you are doing right now, and all of you are definitely helpful, which is participating and engaging in this community. So doing is definitely going to help you find your way back during this pandemic. A lot of the hospitals or some of the organizations where you might have had therapy before have kind of changed how they're giving therapy during the pandemic. Mm-hmm. And some are creating websites and databases and things that offer therapeutic exercise programs. And so one thing might be checking in with that hospital or outpatient clinic again to see what they're offering, maybe looking at your local fitness centers or community gyms for some types of virtual classes. But a couple of websites that I really love are online resources. One is known as Love Your Brain. Have you heard of it?
Yes, I used to take it before the pandemic happened, before that, but I used to take it and I loved it. It was so great going to. I think everybody take it.
So is that loveyourbrain.com?
Loveyourbrain.org.
Mm-hmm. Okay.
So loveyourbrain.org is an organization that was begun for brain injury survivors and offers gentle yoga and mindfulness and education courses for survivors and caregivers. So there's caregiver resources as well. And they're offering virtual as well as they offer some in-person classes in non-pandemic times, which I think they're about to open back up to, as well as offering caregiver retreats, which I think is a big thing also.
Yes, I do.
So loveyourbrain.org is one. And then Tiffany, I think you were really interested in some physical exercise programs as well, how to help keep your strength in your arm and your hand. And an organization out of Michigan, out of Flint Rehab, flintrehab.com, offers some very good rehab-based exercise videos through a YouTube format as well. And another that as therapists we like is a website called Saebo, SAEBO.com.
Say that again.
SAEBO.com. Saebo.com.
Oh, yeah.
That Saebo offers some recovery guides and home exercise programs. They offer some exercise videos, and they are also offering some mindfulness training as well. And then it helps you be able to kind of work your motor skills in that one as well.
Excuse me. Isn't Saebo the glove that they use for the hand too?
Yes, that is one of the devices that they offer. And I have no, as a disclaimer, I have no affiliation with that company at all. I don't make anything off of it or from it, but have just found that some of our clients have benefited from some of the exercise programs that they offer. And they do have some devices that you can use at home that help with some of the electrical stimulation or some of the assisted strengthening activities as well as one activity that's really important that maybe some of you have learned in therapy was what's called mirror box training, or again, how your brain and your hand can work together to help kind of rebuild the pathways and the awareness of one of those weaker sides. So they offer some good educational materials related to the mirror box training as well. Those are a couple.
Okay.
You have any more questions, Tiffany?
No, that's it.
Okay, I have 2 questions for you. Then I'm gonna open up to our audience to see if they have any questions for you. Is that okay, Gina?
Sure.
Okay. The question I have for you is, a lot of people that I have talked to find out that their insurance runs out. I know you just gave us some great examples of some sites, but do you have any tips and tricks that we can actually work on? Because like for me, I have, I overcompensate for my left side of my body. You know, I get massages and my masseuse tells me every time, Greg, you need to stretch your left side. You need to work with your left side. I'm like, I'm getting by. But then I realize, you know, I try to close the door if my hands is full in my right hand and I'm trying to open the door with my left. I can't do it. I don't have enough strength. You know, I was doing one thing, and this was, you know, picking up pennies and stacking them on top of each other, and dimes and nickels, and trying to get that sensation back, because I can't really feel in this hand. So do you have any tips or tricks for someone like me that really can't feel this? They could move it, but they don't have a lot of strength. What should I do to get myself back?
Great question. I feel like that
It's loaded, huh?
it is a loaded question. I feel like that I'm going to say a good therapist, when you left therapy, probably gave you homework. Yes. Or what's called a home exercise program or a home activity program, and said, Greg, you need to go and do this, and you need to do that this much, and you need to do it this often. And they might have been very unrealistic, and they might have said, do it this much and all this time, right? But they don't realize how hard that is to incorporate into what you're doing every single day. And then how day after day, that just gets really boring, or it gets really, you know, you're not seeing the progress that you want, or it's not getting as fast as you want, and that kind of thing. But there's reasons that they say that and they do that. One thing I try to do is help get therapists to give you activities that you can incorporate into your real daily life. But carving out time every day and keeping it in your routine to do those repetitions of these types of activities and exercises is so important, because the research that's happening right now is that they're finding that even hundreds of repetitions of these little movements, which might be picking up these pennies or picking up this pen and putting it over there, hundreds, meaning 200 and 300s at a time, 45 minutes to an hour and a half every day, is helping rebuild those pathways in the brain, and it can help. So they call that repetitive, and that is what it is. It just means do it over and over and over and over. Do lots of it, and it's showing that it can change. So I guess do your homework as much as you can, as long as you can, as often as you can, and then force yourself to use that left side as much as possible. That's another one of techniques sometimes that the therapist and OTs will do, is they'll take that right arm away from you, make you stick it in your pocket or wear an oven mitt on it, so that you had to go around your house all day wearing an oven mitt on your right hand, forcing you to use that left hand to move the mouse on the computer, or open the drawer, or open the refrigerator, or brush your teeth, or whatever those things may be. And that is building those pathways as well.
One last question, and I'll open up the floor. A lot of times, you know, we as stroke survivors, we get discouraged by people's words. So, you know, I went to a therapist, not a therapist, a neurologist. He is the first time he saw me, and he was telling me, you know, nerve damage is the hardest thing to actually deal with. I don't know what medication to do. You're going to have this for the rest of your life. So when I heard that, that just, I don't really concentrate on fixing that because this is what I heard. A professional told me this. So what can I do to actually, I guess it's more mental, what kind of exercises can I do to actually mentally forget that so I can get back to working on that?
Keep the hope. Don't ever lose hope. I feel like that's one of the biggest things that we think about every day is you want to keep staying positive and be hopeful and be future focused. Don't let anyone deflate you. Don't let them bring you down. Stay in today to stay in the moment. Be mindful of your cans and what you can do and what you do accomplish. Stay positive.
Thank you.
Yeah.
All right, I'm gonna open the floor. I have 3 people here. I don't know if they have questions or not. I have Michelle, I have Trezana, and I have Vicky. Do you ladies have any questions? Just give me a nod, yes or no. Michelle doesn't have it. Trezana doesn't have it. I don't know what Vicky is doing because I can't see her face. But what I want to do right now is my 2 guests, I want you guys to close out. I just want you to leave our audience with anything that you want to leave them. If they can get in contact with you or if you know any other things that you want to leave for them, that is fine. I'm gonna start with Tiffany, then Gina, I'm gonna allow you to close it out, and then we'll close out the whole Shy Show. Tiffany, go ahead.
Okay, one more time. What
All right, tell me a little bit more about that. I'm Norm. What is that all about?
Okay. That's what I was waiting for. So I'm Norm. It means determined, inspired, and open-minded. It means that you're a normal person. You're just as normal as everybody else. You go out and you're gonna do everything. You're gonna participate in everything just like normal people. You're not disabled like you think, you think you are. So you're gonna go and you're gonna continue doing these things and not give up on life. You're gonna stay positive and keep going and doing everything you can to participate. So that's why I came out with I'm Norm. And you just have to just keep in your head that I'm Norm. I'm normal. I'm normal.
Let me ask you a question, Tiffany. Where can I get that shirt and where can I get the voice that say I'm Norm?
Well, you can get the voice from me. and you can get the t-shirts from me. I will give y'all my number and my email, and they're sold on Facebook and Instagram. They are actually coming out next week online. Nice. So that you all can buy them offline. But right now you're just contacting me, DM me the colors that you want, and I get you the shirts within like a week or 2.
Thank you, Tiffany.
Because I take my hands and I do them myself. Well, with help.
Better.
Yay!
Do we get the laugh with it too? Yeah, I want the laugh too. Do I get the laugh when you make the shirts?
Yes, I laugh all the time. I'm always smiling, always laughing. So yes, you're gonna get that. You're gonna get whatever you want, as long as it's positive, it's good, and it's
absolutely, absolutely. I'm with that. I'm definitely with that. Gina.
Well, I'm not on social media as much as Tiffany is, but you can find me at Eugenia Herbst at LinkedIn.
Okay.
And then I encourage, if you have a few minutes, you could check out another good website that's called myshepherdconnection.org.
Okay.
It has some really good information for stroke awareness and prevention.
Say that name again.
myshepherdconnection.org. So it also has some good information for caregivers or community as well. So.
Okay.
All right, ladies, I thank you so much for joining us today. I really appreciate you taking your time out to actually help us out in Stroke Awareness Month. This is very appreciative to a lot of people out there. Like I said, I'll be doing these series all throughout the month of May. Next week, we will have recreational therapist and also a massage therapist. So just check us out on AVM Superhero on Instagram, or AVM_superhero on Instagram. And also my YouTube channel is AVM Superhero. If you leave a comment or message on Instagram or on YouTube, I will respond to you guys. Thank you so much for coming on, and I really appreciate you guys. And remember, you're not disabled, you're a stroke survivor. Peace out. I love you guys.
Good night.
Good night.
Bye-bye.